Hey everybody, it is me, Jody Clark. How are you guys? Tuesday. Oh my gosh, it's Tuesday. I've lost a day. I went to my grandson's school today for a Thanksgiving feast. Oh my gosh, it was so cute. They sang all these turkey songs for Thanksgiving. And my mom is in Illinois, so she wanted pictures. So I was sending pictures, and then I ended up FaceTiming her so that she could actually see the video, so she could see him singing. Hey Ryan, thanks for jumping on. So I was just thinking today, my topic of tonight is going to be questions, you guys. So I have a ton of questions daily. Being a nurse, I love it. I have a lot of knowledge. What I consider common sense is not always common sense to other people. It is more of the, medical lingo. So questions. First of all, let's talk about the gel. Okay, so the gel is an FDA registered homeopathic plant-based product. It is made up of 30 botanicals with 191 amino acids, and it's an amazing product. Hey Pam. So our founder, Alexi Goldstein, created this product probably over 15 years ago for MMA fighters. Miss Rhonda, girl, I'm gonna get a hold of you. I have been so busy. Sorry, family stuff. Brian, there's my Broncos guy. What's up? So he made it originally for MMA fighters that were using the nasty, steroids and injections, things that were not safe. And because of the abuse they take to their body, this gel helps to speed up recovery and healing. That's one of the associated benefits. So that's why it was created. And then it was put into network marketing almost a year ago, you guys. I can't even believe the company is like almost a year old, and we have over a 90% reorder rate. So it has been registered with the FDA with an NDC code. Is that legit? Yes, it's legit. You can look it up. You can look for the registration, and it takes, a lot of work, and there's a lot of stuff you have to do to actually get that registration and to get that NDC code. So he knows his stuff and he knows what he's doing. There are negative reviews out there regarding the gel. Hey Javi, hey Susan. And you know what? That's okay, you guys. Some people prefer Costco over Sam's Club. And then the people that love Costco will say why they love Costco more than they love Sam's. Some people prefer Walmart over Target. There's always going to be something negative, but that doesn't mean that the product itself is negative. An over 90% reorder rate speaks for itself. That already is huge to me. The fact that it's been registered with the FDA and nothing negative has been reported to the FDA, that's huge for me as a nurse. You guys, everything you do in the medical field comes with a risk, whether it, is an adverse reaction or a side effect. That's just how it goes, unless it's preventative care. So going in for preventative care, your annual physical, your annual PAP, teeth cleanings at the dentist, it doesn't mean they won't find something wrong, but there should not be a bad, effect from having preventative care. So that was one thing that spoke volumes to me. So a lot of questions that I get is, does it work? Okay, you guys, yes, it works. There are, what are we up to now? Probably about 400,000 people in our secret testimonial pages, which if you guys are not in and you want to be in, I'm your ticket into that. But with over 400,000 people in these testimony pages, the results speak for themselves. The fact that nothing negative has been reported, that speaks for itself. So is the gel safe? Yes, it's safe. Now, if you have severe chronic health conditions, we always say talk to your physician. Talk to your physician. If you're breastfeeding, should you use this product? No, you shouldn't. You don't need it. Enjoy that time of breastfeeding and bonding with your child, and don't worry about the gel. If you are pregnant, do you need the gel? No, your body creates its own HGH. You guys, we are all born with HGH. our levels decrease even as soon as puberty. And then by the time you hit 25, your levels go down even further. And then every decade after, you continue to lose more human growth hormone. Well, we also have an adrenal gland, which should be the size of a kidney bean, you guys. Even stress or caffeine can shrink your adrenal gland. So it's no longer the size of the kidney bean. So that's where you're fatigued or tired. There's so many things with adrenal, problems that we all occur, and have every single day. So having that extra adrenal support and thyroid support, listen to all your friends, listen to your family. How many people, hey Lori, thanks Rhonda for sharing, how many people talk about thyroid issues? So you could have hyperthyroid issues, and that's where your thyroid is working too hard. You can have hypothyroid, where your thyroid gland is not working at all. People have had their thyroid gland even removed. So to have that added benefit of thyroid support along with the human growth hormone, along with the adrenal support, it balances out that axis. You guys, human growth hormone is your mother hormone. It controls everything. And as we lose human growth hormone, you guys, that's where aging comes into play. That's where the stubborn belly fat comes in. I never had it until I got older. Oh my gosh. That's where poor eyesight comes in. That's where gray hair, takes over, or even baldness. That's where your joints start to get stiff and achy. That is where you start having less sleep. Your energy levels are, your mood is affected. Like, there's so many things with aging, because if you don't have a good night's sleep, well, then what does that mean? Your body can't heal. It cannot restore itself. So then you wake up, because you didn't get a good night's sleep. So then you're cranky, you're crabby, you're, walking around with this bad attitude because you've had lack of sleep. I mean, these are just things that happen as a result of aging, as a result of stress on your adrenal gland, as a result of losing human growth hormone, you guys. So to me, the gel is safe. If you have chronic health conditions, yes, you need to talk to your physician, okay? It is homeopathic over the counter. It is over the counter. So you guys need to take that into consideration. What age range is it for? Well, the bottle says 18 and up, which means you're an adult, correct? So if you're 18 and up, then you can use the gel. However, if you are under 18, it would be a case-by-case situation. My son is 13. He is on the gel. His pediatrician is aware of him being on the gel. So we got the okay. So anyone under 18, absolutely speak to the physician. Is human growth hormone going to cause cancer? Is it going to make things grow? Okay, so if you are doing the injectables, growth being human growth hormone, right? The reason we have human growth hormone is to get to our stature of being an adult. Otherwise, we would remain childlike size for the rest of our life. So having growth hormone, it makes you grow. So there are several nasty side effects attached to the injections. You guys, there are none with the gel. The gel is not going to make cysts grow. It's not going to make fibroids grow. It is not going to make cancer cells grow. So that is usually the biggest thing that I get asked is it going to make cancer worse? Is it going to make things grow? No, things are not going to grow. It's such a minute micro dose, and that's why we have to apply it 2, 3, 4 times a day, every single day, even for 30 days or 60 days or 90 days to build it up into our system. And then we go to a 5 days on, 2 days off, rest, because you are now stimulating your adrenal gland, you're stimulating your thyroid, you're stimulating your pituitary gland. So those 2 days off, hey bro, hey Vicky, those 2 days off are actually letting them rest. That is the reason why we take the 2 days off. If you don't see results that you're wanting after 30 days, then load for 60 days, you guys. Hey, Brian. Hey, Matthew. Hey, Peter. If you don't see the results after 60 days, continue for 90. Do you need to take the 2 days off? Absolutely, you need to take the 2 days off, you guys. There's no question about it. You need to take the 2 days off. You need to let those glands rest, okay? That is the reason why we do the 5 and 2. So if you guys have questions on that, please reach out to me. I know in the beginning, like let's say you've done your 30 days and then you do your 5 days and you take your 2 days off and you're like, oh my gosh, I kind of feel, well then keep going for another 30 days, because eventually your body will adjust to having your hormones balanced. You guys don't even realize how out of balance your hormones are until you take those 2 days off and you're like, oh, I'm a little bit hungrier. Oh, I have aches and pains, or my foot that wasn't bothering me all week is now bothering me. You're not done loading. So keep loading. But eventually you will get to a point where you will do 5 days on and 2 days off. Okay? So you guys, that is crucial. Everyone is different. So let's talk dosing. So the Alexei Goldstein, the creator of this, the formulator, he said for optimal results, do 1 blueberry 3 times a day. So every 4 to 6 hours, you could do a blueberry size amount of the gel. And I'm talking about a gel. So if that's something you want to do, other people do 2 blueberry sizes twice a day. Some people need more than that. You guys, some people need less than that. So it really just depends on your body. Don't compare yourself to someone else. Don't look at someone else's results and say, well, that is not happening to me. Well, you don't have the same body type. You maybe are not even the same age. You may not have the same stress levels that person has. You've got to take into consideration, we did not age overnight. Nothing is going to be fixed overnight. So you guys need to stay the course. It takes 120 days to grow new cells. Well, an associated benefit of this is rejuvenating your organs. As we age, our organs shrink in size, and I bet a lot of people didn't even know that. Well, that's why they don't work as well anymore, because they're shrinking. They don't have the capability, they don't have the capacity to work the way they used to work. So to be able to provide new cells to your organs as an associated benefit is priceless, you guys. To have your immune system boosted as a result of this gel as an associated benefit, you guys, it is flu season right now. Every year there's a new strand. The vaccine doesn't work for this, and this. The flu season is extended usually. It usually ends in February, and almost every single year we extend it through April, because there's several cases of the flu still going on, from February through April. So you guys take that into consideration, and all the people that have a compromised immune system, you are a walking target for anything that's going on now that we are in flu season. Even just taking a trip to Walmart, or even just taking a trip to Target. If you've got kids in school, kids are full of germs, you guys. They are literally full of germs. My kids, I don't think ever got sick, because I've brought so many things home that I've been exposed to over the past 19 years of being in the hospital and being in healthcare setting, that, when you have a child and they're young, think about it, and they first start school, and then it's like, oh my gosh, everyone has the crud because they're in school. Well, what are kids doing at school? They're wiping their nose, they're touching the toys, they're touching the books, they're touching each other, and they go to the bathroom. They don't necessarily always use soap and water to clean their hands. They're just a bucket full of germs. So I think me being a pediatric nurse for so many years and being around so many different illnesses and exposed to so many different things, I think I have helped boost up my children's immune systems. So boosting your immune system, you guys, again, priceless, right? Bone density, that's another one. You know, we lose bone density as we age. You think of the elderly who fall on the ice, which is such a bad time right now. Pay attention, because you will hear it as we get into the snowy, blizzard, icy, cold weather. You're going to hear about people falling down and they broke their arm, they broke their ankle, they've broken their foot, they've broken their hip. Pay attention. And you know why that happens is because their bones are not as dense as they used to be. So have an associated benefit of boosting, you know, your bone density. Like, again, that is another priceless item. So it is safe, it is registered. You do need to speak to a physician. It's recommended for ages 18 and up. If you're under the age of 30, you guys, it's more of a preventative care. It really is more of a preventative care. However, if you have some health issues or some health concerns, you know, it may benefit those. So it kind of is just individual. Again, if you're under 18, make sure you speak with the pediatrician. Our pediatrician was totally for that. Not all doctors are for Eastern medicine. You know, they practice in Western medicine. They write prescriptions with no problem. They will write a prescription even just to pacify you. I'm not saying all physicians, you guys, but you got to think about it. They're not educated enough in homeopathic or all natural, so they don't know. So if you don't take the information to them and show it to them and tell them that it's FDA registered, it's safe, they may not know. Okay, and if they tell you no and they didn't even look at it, make sure they look at it. You guys, make sure. You are the patient. You are paying this physician. So make sure they understand exactly what it is that you're taking to them. You guys, what is transdermal? That's another huge question that I get. Transdermal, that's the route we use to put the gel on. That means applying it to the skin. That's the safest form of any medication delivery. You guys, there are many smokers who go into the hospital and let's say they're going to be in the hospital for 2 to 4 days. Sometimes it ends up being 2 to 3 weeks. Well, guess what? You cannot go outside and smoke. You can't. It is a habit. They will go crazy. They will be anxious. They will be moody. I have seen it all from being kept in the hospital and not being able to go outside. All the campuses of all hospitals are now smoke-free. So what do they give these smokers if they're willing to have it? A nicotine patch. You guys, that is the safest way to deliver the nicotine to your body. It gets rid of all the char, the tar, the nasty smokes, the inhalants, all the stuff that go along with a cigarette that make it bad. So we put a nicotine patch. They can have a high dose of nicotine delivered through a patch. So again, through the skin. There's lidocaine and lidoderm patches. Many people are on pain medications for many different reasons. And after a while, you begin to develop a tolerance and they're not working as well. So instead of getting to the nitty gritty of why are we in so much pain, or let's just say it's someone who can't even undergo surgery because they're not healthy enough to go under surgery. So what do? Is they give them more pain medication, or they may give them a lidocaine or a lidoderm patch because it's a safer method. You still get that pain relief, but it's a safer method. So the transdermal route means it goes on the skin. It bypasses, the liver. It bypasses the GI system. It doesn't cause any havoc on the inside, and it goes right into the bloodstream. So do you have to drink water with a gel? You guys, that is probably the most important thing. You are doing yourself a disservice if you are putting the gel on and you're doing it good, your dose is right, whatever, but you're not drinking enough water. You should be drinking your weight, whatever you weigh in pounds, cut that in half, that is how many ounces of water a day you should be drinking, okay? So let's just say for a 150-pound person, they should be drinking 75 ounces of water a day to prevent dehydration. There's so many things that can go wrong with dehydration. You can start having urinary tract infections, you can get kidney stones. I mean, there's so many things that people don't realize just from not getting enough water. Now, let's say you drink a 12-ounce soda. So you're supposed to drink 75 ounces of water, but you also drink a 12-ounce soda once a day. Well, guess what? Now you need to drink 87 ounces of water, okay? So water is the key to getting this gel to work, you guys. So ask yourself, if you're not seeing the benefits, do you need to load, longer? Do you need to increase your dose? Are you drinking enough water? So I just gave you the formula. If you're not quite sure what that formula is and you're not sure what or how to figure out how much water you should be drinking, then let me know. Okay, well, let's say you are a 150-pound person and you do drink 75 ounces of water a day. Maybe you need more, okay? The key to getting this gel in your system and circulating and working is drinking your water, okay? So sometimes, even if you're a great water drinker, you still need to have a little bit more, okay? So water is key. So safe, it works. It works 100%. We wouldn't have over a 90% reorder rate if it didn't work. You may not get the results you want as fast and want to give up, but I'm telling you, you have no idea how priceless the associated benefits on the inside are. So there's many people, I don't know who they are or however, but they're going off their labs. So even though they're not seeing anything, they're not noticing the superficial benefits that everyone else is seeing, they're going off of lab work, you guys. They're going off of appointments at their eye doctor, and they're having, eye vision changes. So you guys, there's so many things that you don't really know unless you've got some lab values or some tests to back it. So just stay the course and trust me. If you go to your annual checkups, if you're on any medications that require lab work, it's gonna eventually show in the lab work, you guys, okay? It may even show in your vital signs. You may be run a higher blood pressure and now maybe it's more on the normal range. I'm just throwing out things. I'm not making any medical claims whatsoever, but I'm just saying these are some of the things that you may not even know what's going on. So if you're not going and getting lab work done on a regular, then that means obviously you're not doing yourself a service right there of taking care of yourself. There's always an annual checkup. There's always an annual mammogram, pap smear, prostate check, you name it, you guys. I mean, there's so many things you should be doing. So if you're not having lab results, things to compare, if you're not going to get your vision checked once a year, if you're not going to get your teeth, even x-rays, you guys, like, I'm just saying there's things that you could invest in before the gel to be able to go back to later and compare. That's all I'm saying. That's all I'm saying. There are associated benefits. I don't know. I'm not making any medical claims, but the gel it's a powerful product. I promote it to 25 and up. I'm into my 4th month, you guys. It just keeps getting better. It just keeps getting better. I cannot wait to be at 6 months or, even a year and see where I'm at. I talked to my mom on the phone today. I can't share her testimony. We're just not allowed. But she is really she's almost getting to the end of her 3 months, and she made me a list today of all the things that she noticed. And I said, can you imagine, even if you're just noticing these small little subtle things that are going on the outside, can you imagine what's going on the inside? But it's taken her some time to even notice some subtle results. So you guys, just trust me in this. Stay the course. If you have any medical questions, if you you're just not sure, take it to your physician, but make sure they take the time to read the information. Like, they owe you that, okay? You're their patient, you pay them, it's a business, it's a service, and don't let them poo-poo you about the gel. Like, make them take a serious look. Take the proper information with them so that they have what they need to give you the best feedback based on you and your health history and what's going on. So, you guys, I just wanted to share. I get the same questions a lot every day. Work on your diet. HGH is the #1 anti-obesity drug on the market. Does that mean you can sit on the couch and eat ding-dongs and pizza and Doritos and drink a gallon of soda a day and expect to lose weight? Maybe you would be that person. I would say it would be rare, but no, that's not how it works. Any weight loss product, any weight loss system that you join, you've got to put the work in. So you've got access to the #1 anti-obesity drug in the market. Everyone is going to start their New Year's resolutions in about 6 weeks? And the top #1 New Year's resolution is always to lose weight, to work out, to look better, right? So if you could have your hands on the #1 anti-obesity drug in the market, like, why would you not jumpstart that now? So message me, seriously, you guys. I will answer and help with any questions that I can. Medical advice or questions, obviously take to your doctor. But if it's anything with dosing or whatever else you guys can think of, like, reach out to me and I'll let you know. If I know, and if I don't know, then we'll try to figure it out and I can at least refer you to your doctor. So I hope you guys have a great night. I am going to go work out now. Now I'm like kicking it in since November 1, and I'm like, you know what? I'm having all these other amazing results. So now that I'm starting to see muscle definition and tone, like my face is fuller and it looks like it's getting skinnier, like I'm actually putting in the work to try to lose the weight to get healthier that way. So you guys have a great night. Thanks for jumping on. Thanks for supporting me. I love you all. And if you want information on the gel, message me and let's talk. Let's get you fit and healthy and invest in yourself. You guys, it's not an expense. Seriously, invest in your health. Have a great night. Bye, everybody.